Everyone, I'm so excited about being here right now. We're live on Facebook, so hi to everybody out there. Like us and follow us. We're going to share the show later on, and I just love this show, and the reason why I love it so much, and I know I say it a lot, but it's a great information for people out there, and I love sharing all of the guests that come on with the audience. My first guest has been on with me. We talked over almost 5 years at least now. I have with me Howard Farkash, and he's a financial services insurance professional. Welcome back to the show. I want you to tell everybody a little bit about yourself and what you do.
Well, thank you. Nice to be back, indeed, no question about that. Basically, I'm an insurance agent specializing in the areas of life products, as we call them. And we're talking about things like life insurance, health insurance, including Medicare, disability income, and long-term care. These are important life products, important protections for people to have throughout their lives, basically. So I've been at this now since about 1997, when I came out here to visit my folks and work with them, help them through their retirement. I've been retired from another industry, basically, and my involvement with them just suggested that I actually start doing this as a career. I've been at it since 1997. I enjoy it very much. I enjoy meeting people who have various financial situations, and we try to make things better. I'm not a financial planner per se. Financial planner will try to make your retirement good and meaningful, and that's very important. What I do is I protect people, make sure they can get to retirement and still have money available for their retirement. So those are the areas that I specialize in. Today I thought maybe we'd spend a few minutes talking about Medicare, because actually that makes up the majority of my work, and talk about two things that are going on currently that people should be aware of, basically. If you are in Medicare and you're on a Medicare supplement, you've probably received a price increase from your supplemental carrier, and probably came with a bit of a shock, because we're now seeing throughout the industry, no matter which carrier you have, we're seeing significantly large price increases, anywhere between 10 and 20%. Traditionally, we've only seen increases of 4 to 6%. So it comes as a problem, is what it does. And for seniors on fixed incomes, especially those perhaps who might be in their late 70s, early 80s, it is quite expensive. Well, I don't want people pulling out their hair over that, because there are solutions, and I might be able to help you out with repositioning you with a different carrier. We can apply to other carriers, try to get into other carriers at lower cost. The neat thing about Medicare supplements is that they too have a large range upon what their premiums happen to be at any one particular age. So that's an important thing to take home with you. If you can't find your current broker, feel free to give me a call. What's that number, Carol?
602-909-8433. I have to say something about you, if it's okay with you.
Why not?
Yeah. I've known Howard now for over 5 years, and I'm going to tell you something about him. You are the most meticulous person that I've ever met, that makes sure that the person that you're working with understands everything that they're questioning.
Well, that's very important. And the reason I do that is, well, it's twofold. Number one, I want to make sure that the client gets the very right product, what's exactly right for him. Medicare can be complex, or it can be very simple. Some people just sign on a dotted line without even reading what they're buying. Other people work hard at finding out exactly what it is they're getting, and I like working with those kind of people who are quality oriented, so they understand what they have, and when things aren't going right with a health insurance or a Medicare product, there's room for there's wiggle room, shall we say. And people say, gee, I didn't know I was signing up for this, that, or the other thing. I want people to know exactly what they're signing up for. That's helpful to them, obviously, and it's also helpful to me, because not only do I sell Medicare products, but I sell other products, and I'd like folks to come to me for those other products just as well. So if I make you happy on your Medicare, then perhaps we'll look at a life product, perhaps we'll look at an annuity product, basically, which will also work out well for you. So it is important to do the job well. To do that job well, you have to get to know your client very well. That's why I ask a lot of questions.
Absolutely.
And that's very important.
His number is 602-909-8433.
Now, when I mentioned that Medicare can be complex, it can also be very simple. So I'm going to give you the 30,000-foot view of your two Medicare choices. When you come on Medicare, you'll have to choose between a Medicare Advantage or a Medicare supplement with a prescription drug plan. And quite often people tell me, Howard, you're offering me the choice between the devil and the deep blue sea. Well, in a certain sense, I guess they're right. Because there are things that people like on one side of the Medicare table and others they like on the other side. There's also things they dislike on each side. So because of that, you've got to figure out what your values are, what's important to you, and then make your choice. But remember this, when you choose a Medicare supplement or a Medicare Advantage plan, you may be forming a relationship with a carrier that's going to last for 20, 30 years basically. Because some plans you cannot move away from, other plans you can move towards, but it doesn't really particularly matter what your health situation is with those plans basically. So it is complex. I know we're getting ready for a break here, and so I'll defer that particular part of the conversation. But I want people to understand from a 30,000-foot view just what it is they're getting on either side of that Medicare Advantage, Medicare supplement table.
Now, I know you have a couple of giveaways today. I'm going to open the lines to you so that they call to you directly about, you have a book and it's called Medicare Made Easy, and you could just call Howard for it. It's 602-909-8433. Before we go to a break, I'd like to just have you say a little bit about it real quickly.
Well, sure. This is, well, I'm just about getting ready to present the Medicare in its simplest form. This is a little more complex. It actually goes into the complexities and tells people how to deal with those complexities and what the consequences of those complexities happen to be, basically. So that's a pretty important thing to know. We don't want people making mistakes when they sign up for Medicare. We want them to be happy with their product, and we want them to be able to justify it to their friends or family who's going to say, you did the wrong thing, you should have gone the other way. Mm-hmm. We don't like those kind of conversations. We don't want people unselling the products that they have chosen for themselves.
Well, you can get this book. It's called Medicare Made Easy. Just call Howard at 602-909-8433. And you know, one thing that has happened, a lot of people are a little bit surprised, is that the payments are now going to be a little bit higher. And if you're not happy, you can talk to Howard and he can help you with that. Again, just call Howard. That number to call is 602-909-8433. Hang tight. We're going to be back in just a minute.
Very good. That's fine.
We're still live in the room, so we're going to keep on talking.
No, I understand.
Okay.
I think we did fine.
Yeah, you liked it?
Right.
Good.
It worked very well.
Good.
And we'll just carry on with that same line of discussion.
Would you like to refer to the white paper when we get back?
To the white paper. We want to refer to the, if your broker's not available, you're looking for a new broker, we want to go that way.
Okay.
Yeah. And how do you select a broker? That's what the white paper is all about. And the book is Medicare Made 1, 2, 3 Easy.
Oh, it's one. You didn't say that.
I may not have said that.
Okay, I got you. 1, 2, 3. I got it.
I understand. I'm getting old.
Oh, me too. How do you select? Okay. Okay, got it. So first I'm going to bring back the book so I can re-say it again, okay? And that's going to be one, and then I'm going to say the question if you're looking for a broker.
Yeah.
Okay? And then you can talk about the white paper.
Right.
Okay.
That might gravitate into other areas, some of the other light products, etc.
Okay.
I want to talk about when I say our, I'm a solo practitioner, but I have strategic alliances.
Oh, I totally understand that. I would do the same.
Yeah, and so I'm into a WealthWise program, okay, to teach young people more about money, how money works. That's important. So
Have you met?
I want people to ask for that book. I have another
You have
book.
another one? Not today.
How money works. How money works. If I bring it out, you can re-articulate it.
Okay, I'll try. Okay, yeah.
How money works.
That's it.
Are we having fun yet?
I am. I always
always
do. Especially when the days are like today.
Oh, well, this is great recovery.
You know what, one thing that you learn when you're doing a live show is you gotta figure it out.
Flexibility.
Exactly.
He's trying to tell us something.
We're ready, ready?
Aye.
He's trying to tell me that we have a
That's-
little more than 30 seconds, so he's trying to tell me that. So welcome back, everyone. We're talking with Howard Farkash, and he's a financial services insurance professional. He's been doing this since 1997, and he's helped a lot of people. You've been on the radio talking about what you do and helping people for over 5 years with me. And we want people to understand that if you might be looking right now for a broker, we're going to talk a little bit about that. And I want everybody to also know that we have the book that is also available to you by calling Howard. It's called Medicare 1, 2, how do you say it?
Medicare made 1, 2, 3 easy.
What? Okay, there you go. It sounds funny, doesn't it? So it's Medicare made 1, 2, 3 easy. All you have to do is call Howard, and
They complicated the name, right?
They did. They should have made it. I better call them. The phone number is 602-909-8433. Just call Howard, and he'll tell you the exact way to say the name of the book.
It is true that in the last segment, I indicated that Medicare is complex. And so I fully recommend that if you're thinking about doing this for yourself, that you may want to really contact a broker and work with a broker. It is complex. There are people out there in the world who will spend more time planning a 1-week vacation than they do planning their coverage for going out for 25 or 30 years. So get a broker or somebody who knows exactly what they're doing, somebody who lives the life, maybe preferably somebody who is in Medicare themselves, as I am, knowing it from both the inside as well as the outside, and be able to give you the guidance that you need in order to make a good decision for yourself. Now, I do have a white paper which helps people interview brokers. I think try to remember this. If you're interviewing a broker or looking to work with a broker, you want to interview him as you would any employee who is coming into your company, basically. You want somebody that you can work with and somebody who's knowledgeable, and I have a white paper that describes that. And you can get that white paper just by calling Howard at
602-909-8433.
And you can go ahead and use the notes in that white
Right.
paper. If you're not my client at the present time, go ahead and interview me. Why not?
Mhm.
And find the answers that I have, basically. See if we're compatible, if we'll work well together. Good for your team, because I do want to be part of your financial team, basically, along with your financial advisor. I should be part of your team just as well.
Again, that number is 602-909-8433. Just call Howard. You'll be happy you did.
So now you realize I've said it's complex, but I also said earlier that it can be simplified just as well. And for the purposes of this show, we'll give the 30,000-foot view of what it happens to be, basically. If you're one of those people who don't like a lot of detail, this might be very, very good for you. When you come into Medicare, you have that basic decision to make between Medicare Advantage and Medicare Supplement with a prescription drug plan. The important things for you to recognize, or what you want to know, is what are the differences? Why should I do one versus the other? Medicare supplements have a premium. The premium, just for the sake of argument, at age 65, might start at around $100, $120 per month, okay? Medicare Advantage plans do not have a premium generally. There are some that do, but most don't. So we're all big kids now. We know the difference between $120 a month and zero free. The people who run the Center for Medicare and Medicaid Services don't like us to use the word free, but my client they use the word free, okay? So that's one thing that you've got to look at. Which side do you want to be on there? The other is how the plans work. Medicare Advantage plans are network driven. You have to go to doctors in network. Not a big problem per se, but perhaps maybe it is a problem in the fact, does your doctor belong to the network of the carrier that you're looking at? So that's an important issue. Prior approvals. Prior approvals are required for Medicare Advantage. They're not required for Medicare supplements. Now, why is that? What are we talking about? Does it happen every day? Does everything need to be approved? No. In fact, Medicare Advantage plans are great for people who are young and healthy. Young meaning 65 to, say, 75. But as we age, we start incurring conditions that will necessitate more expensive procedures. Your HMO Medicare Advantage plan will definitely have the right to adjust what your doctor has said, what kind of therapies, what kind of practices he's going to use, what kind of surgeries will be authorized. So you have a prior authorization issue with Medicare Advantage. You don't have that with Medicare supplements. That's something for you all to consider just as well. Now that's about the 30,000-foot view of it and how you make your decision. Once you've decided what side of the street you want to be on, you've eliminated about half the problem, okay? Then it's just a matter of finding the company that's going to work best for you, either cost-wise, or it's going to work well for you on the financial, financial being the cost side, work well for you on the service side, basically. Those are things that you need to be aware of. Also on Medicare Advantage, just because there's no premium doesn't mean that later on, it's a pay me now or pay me later event, okay? With the premium you're paying now, with the premium you make charges, you pay charges for services rendered at the time of service. So that's another important thing for you to remember, and those could actually exceed the cost of premiums. This is complex. I don't think you should do it yourself. I don't think you'll be happy in the long run. I often say that Medicare, by the way, Medicare Advantage has come under a lot of congressional scrutiny. There are a lot of practices that they have within that approval and prior approval area. But when we look at Medicare Advantage on paper, it looks beautiful, it sounds beautiful, but when you get into practice, especially if you're a senior, 75 and above, maybe
Oh, thank God.
a seasoned, or we call that a seasoned senior, okay? When you get into that part of the population, that's when you start running into problems. If you can guarantee me that you're not going to get sick for the next 30 years, and I say seriously sick, I don't mean colds and flus and broken arms, but I mean if you have serious medical problems, if you can assure me you're not going to have that over the next 30 years, and you're turning 65 now, I'd say wonderful. Medicare Advantage is the absolute right plan for you. The problem is the implementation of Medicare Advantage. It is highly judgmental and highly controversial, which causes a lot of people to have a lot of angst over medical advantage plans. So you want to put that into your decision-making process, your so-called Franklin analysis. This on this side, that on that side, which do I like better, which suits me better.
Now, if you have not called Howard yet, you can also call him to get just the white paper and interview him. He's asking you, interview me and see how I can help you and what it makes you different than, other people. Go ahead.
That's part of what makes us different, yes. The fact that we also offer the full range of financial products, because when you are looking about your health insurance, which you're very likely to be losing when you retire from your company, basically, you probably have other issues like relocating your 401k plan. You have other issues like perhaps you're losing your life insurance. You still want a life insurance product. Perhaps you want to move your 401k plan. Perhaps you want to move it out of a volatile market into something that has both growth and safety aspects to it.
Mm-hmm. Well, there's a lot of reasons to give you a call, especially right now in the world that we're living in.
Absolutely.
Right? But it's all about protecting. You talked about that earlier. It's protecting yourself and having some peace of mind.
Well, protecting your family too.
And your family.
Right, exactly. So.
Okay. Now, the book is for Medicare. It's Medicare made 123 easy. That phone number to call him is 602-909-8433. You can also call him and get the white paper that he has. It's questions to ask, how to interview a broker such as yourself.
Right, Carolyn, as I mentioned during our break, I have a third giveaway, basically. And it's the book, How Money Works. Why is this important? It may not be overly important for seniors. We think they know how money works. But some of our younger members, and I do get referred to the children of these seniors, basically, and be surprised how little people know about how money works.
how
So-
not very much they know about it.
Right, how little they know about it. Realistically, what it comes down to though, is I like to use the word financial knowledge. And let's face it, the YMCA talks about body, mind, and spirit, okay? But I think there's a fourth component to life that you need to be very, very aware of and get boned up on very quickly, and that would be financial literacy. I call it financial knowledge or gaining financial knowledge. I work with a group called WealthWise, basically, and their programs for financial literacy are very helpful to people, basically. You learn what mistakes not to make by understanding the basics of how money works.
Now, we talked a little bit of that for the young folks. Is it really ever too late, too late?
No, anybody who's interested.
Unless you're
in
a seasoned senior.
No, it's not too late. I'd be happy to talk to any seniors about that.
Yeah, because people need to know, as they really do, and a lot of times, even if you're just, getting into your 50s or 60s or what have you, it's really something that today almost everybody should know. Right?
That is correct.
Now, the book is called How Money Works, and you can call him for that as well. He's got How Money Works, he's got Medicare Made 1, 2, 3 Easy, and his white paper for how to interview a broker such as himself. That phone number is 602-909-8433. And let's understand that this is life insurance. These are
Right. Of course, there's no charge for any consultation that we have. As far as that's concerned, I get paid by the carrier that you select, no matter what the product type. So
it is a free service to the family.
Exactly. Now, there's nothing unusual about that. That's how all life insurance agents and Medicare agents, that's how we all work, basically. The big difference, coming back to how we work with my agency, is we really get to know our client. That's the most important thing, because you can't do right by people unless you understand what their goals are, what they're trying to accomplish, unless you understand their money situation, basically. Those are very important aspects. So,
but be prepared to answer those questions, and it's not like they're prying. It's not about that. It's about finding out things about you to help them get you the right product for you.
That's true. Carol, often when we do these conversations that we're having today, you ask me what's the most frequently asked question.
Yeah, what's the most frequently asked question you always get?
Gee, I was waiting for that. But the moral of the story is, people ask me, give me a quote on this, give me a quote on that. Well, quotations just begin to talk about what we're doing. We really need to understand the product, how it works, what its limitations are. Those are so important to getting the right product at the right time.
Just call Howard. His phone number is 602-909-8433, whether it's for the books or the white paper. Again, 602-909-8433.